Hello, I'm Dr. Helane Fronek, and I'm here with my friend and colleague, Diana Neuhardt. Diana, you are one of the most extraordinary ultrasound technologists who I've met.
Well, thank you.
Yeah, you're welcome. You're welcome. And you know, to me, ultrasound is the single thing that has changed the field of vein treatment more than anything else in its entire history.
Well, I agree, and I can say that because I'm the master of that technology. It's a technology that has evolved, and not only in phlebology, but other segments of medicine. As the technology has improved and the digital sophistication and all the things that have made it better, we've actually been able to bring treatment options to patients. And that's all because of engineering. So the engineers who started making the device, they said, how could we make it better? And as sonographers and sonologists, we said, hey, you know, if we could see closer, if we could do this, then we could offer this for a patient or make a better diagnosis.
You know, if I could get a hold of some of those engineers, I would give them a big hug. Because I think what we have in ultrasound has made it possible for us to diagnose vein disorders and treat them in a much more successful way, wouldn't you say?
I agree. The nicest thing about ultrasound is that it's painless. In case a patient comes in, a lot of times they're very frightened.
They are.
Most patients come in and they always worry that they have blood clots, even if there's really no indication of that. They become frightened, and so in my office, we have a very comfortable environment. It's not sterile. Actually, I have a couch in my waiting room. And so they come in and we really explain what we're going to be doing, and we're going to put some gel on their leg. We're going to have them be relaxed. It's in a dimly lit room because we're using a screen, like a television screen, and so we're putting some sound waves into their body, which is harmless and it's pain-free. So then the ultrasound, with all the digital sophistication, it actually images the blood vessels very nice. But that's not the only thing we see. We see muscle, we see arteries, we see bone, bursa. So all of the things from the skin line we're able to differentiate. So sometimes patients come in and they think they have a vein problem. Maybe they're having leg pain. But sometimes we can also, depending on what they present with, come away with more information than just the vein problem.
As a physician, I really depend on my ultrasound. It obviously gives me the right diagnosis and it guides my treatment. The other thing that I love to use it for is to show my patients. We can actually show them the vein that they have, we can show them the blood flowing, tell them what direction it's going, and it really helps them to understand what they have.
Precisely, and I think as sonographers and professional we call them mammographers or whatever our specialty is, and for us it's ultrasonographers. And so as ultrasonographers, we have a huge understanding of what we're seeing. And patients are very curious. But mostly,
I'd be curious.
Mostly if we explain to them everything we're doing and everything we're seeing, then they can relax because they say, oh, okay, so that's how you know that. And so we use different techniques in the method of diagnosis. So for instance, if a patient came in, we would first have them lie down and relax. And we would take images first of different parts of their body, in this instance the leg. So we start with the deep vein. So we can do that while they're lying down and just relaxed. So we look at different techniques, and then we have the patient stand. And I think that's a really critical thing for patients to understand. They're standing because of gravity, and that's when our veins are the most symptomatic. So if we have a way that when patients come in our office, I have a very comfortable large step with rails so they can stand there and be comfortable. And so we're using gravity to then look at how that impacts the blood flow in the veins.
You know, it reminds me of if a cardiologist is trying to find out if the heart is pumping well enough, they'll put a patient on a treadmill to put the heart in a situation where it might be stressed. And I think it's the same as when we have our patients stand up. that's when our veins get stressed, and that's how we can really make the correct diagnosis.
Well, in doing that also, there's different veins that we treat. We are used to hearing about the saphenous vein, but there's other non-saphenous veins or other things that we can detect simply by having the patient stand and doing a clinical examination.
You know, that's a really important point that you just brought up, that ultrasound in the field of phlebology is not just used for diagnosis, but it's almost essential in treating a lot of the veins that we treat. Would you agree?
Well, that's the beauty of ultrasound, too. It has two methods. First, the diagnostic, and then we also use it as a tool in which we use real-time visualization.
What do you mean by real-time?
Real-time is a term where it's simultaneous information. So when we place the transducer on the patient's skin, a little bit of gel to transmit the sound waves through the body, then it's instant information. It's sending and going all the time. I mean, the microprocessors are amazing. So we know instantly that's the information. And so when, for instance, we want to use it to determine if we can inject a vein. So sometimes there's veins deeper underneath the skin that we know are abnormal from our diagnostic ultrasound. So then we use the ultrasound as our tool. So we need to find that vein, and then with just the solution and the needle, you can just guide it right into it, and it's click, done.
Right.
Where before it took all the, now we have no, it's all the guesswork is gone.
Well, a lot of the guesswork is gone. I know that when we're treating patients, feel so comfortable when we can see the needle go right into the vein, we can watch the solution that we're injecting fill the vein, and then we can watch the response of the vein to what we're doing.
Correct. So all of these different methods that we have gained through experience, what to expect when this happens. So when we have that simultaneous information, we know we're in the correct vein. So it really minimizes all of the risks that can happen if we just go blindly. We're not seeing where we're going.
How did you get started in the ultrasound field?
Well, that's such a good question because I've actually grown up with ultrasound. I'm so proud of the amount of knowledge that I have, because when I started ultrasound and started my career, we really only used ultrasound as a listening device. And we mostly use it strategically for very limited OB ultrasound. So obstetrics. And as the...
Oh, you would listen to the baby's heartbeat with an ultrasound device.
Yes, and we never had the way to look at blood vessels and listen to them with Doppler. We either had to have a handheld Doppler and then look with ultrasound. So now those great engineers, they married the two technologies. So that's called duplex. And so sometimes the doctor will say, you need a duplex ultrasound. So that's kind of how that term came about, the two technologies. So when I started ultrasound, I was in pre-med. And
you were pre-med?
I was in pre-med at the University of Washington. And this technology was available. There was lots of other things, too. Everything was growing. But then something really tragic happened to me. I think I told you about that. I actually was in college, and my leg started to swell. I was an athlete, and I didn't think too much of it. But then my leg started swelling more, and I recognized that I probably needed to seek some medical advice. So I went to the clinic, and the doctor told me he thought I had a blood clot. I was really frightened, and at that time, and this is giving away, before we even had ultrasound to make the diagnosis, I had to have a venogram.
A venogram.
And that's where they inject dye into the vein, and they use radiographs to determine if you have a blood clot.
So they actually put a needle in your skin and then take a bunch of x-rays, right?
Correct. It was very painful, but mostly it was frightening. And so they told me then I had a blood clot in my leg and that I had to go into the hospital. And I had 2 small children, and it was just really, really scary. And the most frightening part was that there was really not a good explanation why I developed a blood clot. So it was 5 days in the hospital, and it was really lonely, and it was really a telling time for me to say, what can I do? What am I going to do? There was no answers. So I actually then decided I didn't want to do this thing, I wanted to do that. And it kind of evolved, and I'm just very fortunate in my mentors and my career where it's taking me. But one of the greatest things was meeting some physicians about 15 years ago who were going to dedicate their practice to veins. And I was...
And there you were.
There I was.
Person, because you know what it's like from the technical, medical side, and you also know what it's like from the patient side.
So when patients come in, I know how frightened they are. But I also know what an impact those doing the test can make. So I dedicate myself, and you too, to teaching others how can we help the patient the best. And it's been a great career, and you know, I've learned a lot, and I hope to continue learning. I mean, it's a lifetime learning.
And nowadays, people don't do venograms anymore, do we?
Correct. We use duplex ultrasound.
We use ultrasound. And the ultrasound's pretty accurate and saves people from having to go through that painful procedure, wouldn't you say?
Yes, absolutely. In fact, largely it's now become what we call the gold standard, which means we use that mostly because it's sensitivity and specificity and all these things we talk about. But it's really accurate in the correct hands. So I think it's important when a patient comes in and they have choices where to get their ultrasound. But make sure the person, you can even ask them. I think patients should say, what type of credentials do you have? Where did you get your training? Because there is national certification for ultrasound.
Oh, wow.
So we not only have registered vascular sonographers, but we also have registered phlebology sonographers. It's a new certification because phlebology has become so specialized. So that's a great thing to ask as a patient, ask your professional.
So you grew up with ultrasound, and now we're going to move into the future where ultrasound creates more opportunity for us to know more about our patients, better treatment techniques to treat our patients. It's an exciting time. And Diana, I really want to thank you for coming in and talking about a subject that you and I both love. I really appreciate all of your expertise. You're an extraordinary sonographer, and I know that you contribute so much to the field. It'll be fun to see how ultrasound continues to be involved in the field of phlebology in the years to come.
Well, thank you for inviting me, Helane.